So on your sheet, you've seen in that first column this term anaerobic threshold, and it's a little bit different to aerobic endurance in that it uses that word anaerobic, so it might be a bit confusing. However, it is a test or a piece of what we call exercise physiology, which is important for 2.3, and I'll explain why. So anaerobic threshold is a term to describe, in this first part here, is the intensity. Remember, intensity is how hard we are working. It's the intensity of exercise at which the blood concentration of lactic acid rises sharply. So all that's saying is, remember we talked about lactic acid, when you work hard you start to get the burn in the muscles, or your muscles feel really heavy, or they might feel a little bit sore the next day. That's because, in part, it's the presence of this lactic acid. And what it does is, what that's saying there is your muscles produce it faster than it can be metabolized, and that's a fancy word for being gotten rid of. Alright? So what happens is we work at a high intensity and we go okay for about 100 meters, maybe then for about 400 meters, but then what happens is the lactic acid starts getting produced faster than it can be gotten rid of, and we have to slow down or stop. Alright? The point at which that happens is what we call our anaerobic threshold. How do we measure it? So essentially, if we have a look at the measurement, we come over to here, we measure it as a percentage of our maximum heart rate. Remember, we used heart rate as a measurement of how hard we're working, or our intensity. When we get to about 75% of our max heart rate, if you're an untrained individual, what that leads to is the person at 75% of the max heart rate, when they're not trained, they hit their anaerobic threshold. So they start producing lactic acid more than it can be gotten rid of at that point. Whereas a trained individual is likely to be hitting their anaerobic threshold at about 85% of their maximum heart rate. So that means they are able to work harder before they get to that point where the lactic acid kicks in. Is there any questions on that? So essentially we want to have a higher anaerobic threshold, because that means we can work harder before our lactic acid builds up more than we can actually get rid of it. What's the importance? So essentially that's what I've just said. We can work harder before your muscles get the burn from lactic acid, or that fatigue, or we can work for longer before your muscles get the burn or that fatigue. So we want to do some training that is going to try and improve that anaerobic threshold, because the anaerobic threshold in kiorahi will quite often, and when you're playing competitive kiorahi, you'll reach that anaerobic threshold quite a bit. So the higher it is, the better off you're going to be in kiorahi, because you are less likely to hit it, and you're more likely to be able to carry on at a high intensity for a longer period of time. So when you go to do your training, if you are wanting to improve this anaerobic threshold, then you'll be looking at doing things like high intensity interval training or fartlek training. So you're doing longer periods of work, so 3 to 4 minutes or 2 to 4 minutes, and shorter periods of rest, all right, at high intensities of work. So this here, if you're a netballer, a basketballer, a footballer, any of those types of sports, if you're wanting to improve your ability to work hard for a longer period of time without fatiguing, this is the type of training that you potentially should be aiming at. Alright? So that is what anaerobic threshold is. Is there any whātai? Carl? Okay, alright, stop that there. Cool. So what I